I'm Dr. Richard Goldfarb, the Medical Director of Aesthetic Factors, makers of Seplhyl. Seplhyl is a system utilizing your own platelets and plasma for cosmetic enhancement. The following videos demonstrate my personal technique using Seplhyl. I'm going to demonstrate to you the use of Seplhyl in the tear trough area. We use approximately 2 cc's of product in this region in order to achieve our maximum benefit. My technique is that I locate the tip of the zygoma, and in 2 linear threads I go from the zygoma towards the bridge of the nose. My angle is up towards the subciliary region for my first injection site. My second injection site is beneath this area or towards the malar region, again going towards the bridge of the nose. We do this in a retrograde filling type of procedure in order to achieve our maximum benefit. What we find is that the needle itself creates a tract, and therefore the product can then be released in a retrograde fashion. We are now filling the left tear trough area. After locating the tip of the zygoma, we make 2 linear threads in the deep dermis. Again, we're creating a tract, and therefore we're going to be able to put only 2 linear threads in, and then we will not have to disrupt the matrix, and therefore we're going to allow Seplhyl to release its platelets over the 7-day period of time. What we find is this will build a scaffolding effect upon the already existing collagen that she has in her deep dermis. As you should note is that we are tenting the skin, pulling it very tight in order to allow a curvilinear plane to be a straight plane, and therefore keeping it in the reticular dermis. The next patient is having her nasolabial folds filled. As you can see from the angle of the mouth, we are placing the 27 gauge 1 1/4" needle right into the nasolabial fold, and in a retrograde fashion we are filling this defect. We are again in the reticular dermis, the area in which we want to build upon the already existing collagen. The Seplhyl, which will allow this to build upon this by leaving it in this deep dermis, will then give her the most maximum effect. We do not want to allow any of this to be placed in any other layer in order to achieve our maximum benefit. Each person will require a different amount of Seplhyl to be placed into the nasolabial fold. For this particular patient, we felt 1.5 cc in each nasolabial fold was more than adequate in order for us to fill this area. Our end point is when we visually do not see the nasolabial fold. We find that each patient obviously is a little bit different, just like it is when we utilize fillers. We have to place a certain different amounts. This gentleman has nasolabial fold defects. He has desired for us to fill this with Seplhyl. As you see, we are placing Seplhyl in a retrograde fashion, starting from the angle of the mouth and up into the nasolabial fold. We place approximately 2 cc's into the nasolabial fold in the deep dermis. We are pulling the skin very taut in order to keep the needle itself in the deep dermis. We are now placing Seplhyl into the tear trough area, starting from the zygoma and pointing towards the bridge of the nose. We are filling in a retrograde fashion, and we're able to achieve our maximum benefit by placing it into the reticular dermis. What we find is if we create a bleb or an overabundance of Seplhyl in this area, the area will nicely smooth out over time. We do not have to worry about a granuloma forming. We are now demonstrating the left nasolabial fold, and after we pull the skin very tight, we're placing Seplhyl again in a retrograde fashion in the nasolabial fold. What we find is that this will allow us to keep it in the reticular dermis and build upon his existing collagen. We are also demonstrating the left tear trough area, and from the tip of the zygoma towards the bridge of the nose in 2 linear threads, we're able to fill this region. We are demonstrating fill of the nasolabial folds in this next patient. This patient had a defect in this region and required a filling of this area in order to give that smooth appearance. The quote parentheses were bothersome to her. As you see, we are filling this in a retrograde fashion, so after placement of the needle in the nasolabial fold in the deep dermis, we are filling approximately 1 cc in a retrograde fashion. As you can clearly see from the video itself, we tried to make as few puncture sites as possible. This patient has suffered with cystic acne since her adolescent days. She really has quite a large amount of defects in her deep dermis. If this is existing, you may have to do a subincision in order to release this. Once this is released, we want to fill in this defect with Seplhyl. We're able to do this in a fanning technique. Once you pull the skin very tight, you start from an inferior puncture site and then fill these entire areas with Seplhyl. We sometimes have to utilize up to 4 cc's of product on each side. It depends on how big the defects are and how deep the defects are. We certainly do want to fill to the maximum amount in order to achieve a nice smooth appearance. We visually want to see that these defects are no longer existent, and therefore we'll know that we can build upon our already existing collagen. We find that it may take 1 or more treatments to achieve this, and in approximately 6 weeks, these patients return to our office, and then we will evaluate for a second treatment. Again, we're performing this in a fanning technique, staying in the reticular dermis in order to build upon her existing collagen. The platelets do release these growth factors over approximately 7 days, and within 4 to 6 weeks, we can usually see our benefit. I find that these patients are extremely happy once they have the Seplhyl placed, as it gives that natural, nice, smooth appearance, building upon the already existing collagen. The left side of the face will now be demonstrated. As you see, she has residual cystic acne defects as well. The cumulative effect of filling these defects, along with the return of some moisture and texture to her skin, is also a desired effect. Seplhyl will be able to give you that, where the synthetic fillers will not be able to return any of that type of texture or moisture back to the skin. We fill this in this retrograde fashion, once again in linear threading, and we use approximately 3 to 4 cc's, depending on how deep the defects are. The cumulative effect of Seplhyl will give you not only the texture, moisture return, and the filling of these defects, but it will also give you a nice natural appearance, something that all the patients desire.